Welcome to This Just In, the show bringing you the latest advancements in healthcare, strategy, innovation, and public policy. And now, for the fastest voice in healthcare, here's your host, Justin Barnes.
Thank you for tuning in and welcome to This Just In. I'm your host, Justin Barnes. In these segments, I'll bring you the latest advancements in healthcare, strategy, innovation, and leadership. As always, we're broadcasting from the This Just In studios on the Business Radio X network, as well as the Healthcare Now radio network. For this episode, my 281st episode, we have a great show focused on chronic care management with a longtime friend and healthcare innovator, Matt Ethington, co-founder and CEO of ChronicCareIQ. Welcome to the show, my good friend.
Thank you. Happy to be here.
Yeah, it's great to have you on here. I can't believe this is your first time. But I know, we've known each other for a few decades now, and I have a tremendous respect for what you've built at ChronicCareIQ. It's not only a great business, but you are truly transforming patient care across the country. And I can say that because recently, when this show came to fruition, was one of my former EHR customers is now a customer of yours, is a CCM customer of yours. And I was able to speak with them. It was a random occurrence, but very fortunate. And their story and testimony is just invigorating and exhilarating. So I had to bring you on air. I can't wait to talk about it. I've been, I was putting the show together and just thinking about, I've been working on CCM, RPM, value-based care initiatives and care models for almost 20 years now to see this come all to fruition. And then certainly, you, a friend, being, implementing this, it's exciting. So, again, welcome to the show and so excited to have you here.
Well, it's high praise coming from you. So thank you again. So happy to be here. I feel like I joined a pantheon of people that I respect, watching your show in the past. So certainly a privilege. Thank you.
Thank you, Matt. Yeah, no, this is a long time coming. Again, I've been so deep in chronic care management and remote patient monitoring, just value-based care in general and accountable care in general, in the policies and the regulations behind it. But to see it now taking traction across our communities, and then again, speaking to, in this case, our care, a great FQHC, one of the largest in the country out of Arkansas. Happen to be out of Arkansas. Just phenomenal what they're accomplishing. And then just to see, again, then being able to talk to you offline to know what you guys, learn more about what you guys are doing, how you're expanding, how fast you've been able to grow the company recently. I know you've been around, you and I came across each other. We probably actually know each other over 20 years, but, we came across each other around, I think, 2015 or so. You were just starting the company, but then also, a lot of this was all new. And so with chronic care and transitional care management and transition care management, there's and even discharging and those the components and those care models. And so, and being able to manage that. And so you pull this platform together. So I guess at a high level, why are you so passionate about this? And where's that passion come from?
Yeah, fair question. And I think it helps differentiate the company. I got really sick. When I was 30, I felt like I was on, top of the world, great friends, good athlete. And I started losing weight. And I went from losing a little bit of weight to losing a lot of weight to getting very thirsty, and to, waking up at all hours of the night with cramps and being in pain. I finally went to the emergency room, and I learned there that I had type 1 diabetes. And for people that don't know, type 1 is the kind where you have to give yourself shots. And your body doesn't have the ability to produce insulin, which is required for you to live. So you have to give yourself shots, and you have to check your blood sugar. You spend a lot of time poking holes in yourself. So I went from being in really good shape to being in really bad shape, and having to spend a lot of time aggressively managing that. At any point along the way, it can be deadly, short-term, medium-term, and long-term. So that. So going through that emotional and those physical experiences and doing that today, I know the burden firsthand. And then second is there's so much room to improve how we provide chronic care today. So it's really actionable, right? It's when you take on a challenge and you can see immediate progress, it keeps you motivated. So an easy thing for me to be motivated about.
I love it. Great answer. Without sharing your legal secret sauce, what's your secret sauce? I mean, again, I'm coming off this conversation with one of your customers. I did a little bit more research. You guys have certainly tapped into something, but what's your secret sauce?
Um, I would say, first of all, is I have an incredible co-founder who wasn't able to join us on the show, but his name's Eric Eschenbach, and he's brilliant, right?
Mhm.
So I've got a like-minded individual helping me. It's not just me.
Mhm.
We have a whole team. I really do think if there's one thing, though, it's that we solve problems, right? We solve problems. Um, Chronic diseases today, they're responsible for 7 out of 10 deaths, although the vast majority are non-lethal. They're responsible for 99% of Medicare's payments, right? So 99% of the checks that Medicare writes are to people that have chronic disease, and it represents 93% of the total. And the problem that we solve is that doctors and patients are kept apart from one another, right? Thank goodness we have doctors that know how, spend 10 years learning how to care for people. But the challenge is they don't go home with you. I left the hospital with 2 prescriptions and a pep talk, and that creates a big gulf. So if you're trying to manage anybody with a difficult to manage chronic disease and you don't have information about that patient, it's next to an impossible task. So the first problem we solved was not relying upon the doctors to gather information about the patient, but relying on the patients to update the doctors.
Mhm.
And once we solved that problem, right, making it easier for patients to get the doctors the right information at the right time, then it became, well, how do we get the nurses to do it, right? Everybody in healthcare is time constrained. So we cracked the code on why do nurses use this product, so reliably, and the doctors, of course, have already figured out they want it. They went to school for 10 years to provide care.
Okay.
The third problem we had to solve, and thank goodness, Medicare's pouring money into this area, right? 99% of the checks they write. So anything they can do, they're doing. Well, the vast majority of these reimbursements for these activities are based on time. And so we made it easy to capture that time so that that helped a practice get paid in many cases for the work they were already doing. It helps patients engage, so they're keeping the doctors updated. And it just kind of turned into a virtuous cycle where when the doctor has the right information about the right time, they can be preemptive and predictive with patients. And when the nurses have a reason to engage, and they do engage, the patients get better, they get healthier, reduces the complexity of complex care. And all of that comes down to is solving the problems that come up when they come up. And we're really focused on solving problems.
Yeah. Well, that's a sign of a phenomenal entrepreneur, and a successful one too, because you're solving real world problems. And obviously in one of the largest spaces, we have $4 trillion a year getting 4.1 trillion or so now being pumped into our healthcare system. And obviously chronic care is the largest single expense of that in the healthcare system. So obviously you're solving a very big problem. That's why you've seen the success. So congratulations there. As a follow on, you covered some of this, but what does a good care management program entail?
I think first is realizing the problem that you're trying to solve. So, the first one is waiting for sick people to get sicker
Mhm.
has enormous consequences, right? So if you're going to manage sick people and keep them from getting sicker, you have to engage them. You have to know what's going on. So I think the first thing is you need to know what's going on, right? And then the second thing is it's not a one-sided thing. Just having that information doesn't make it actionable because, like I said, everybody in an environment is time compressed. So you have to make it easy to interact with that information. So, for example, we ask patients questions through their phone, or we ask their children questions through technology, whatever the case is. And the questions that we ask, the frequency with which we ask them is all automated with clinical protocols. And that information's in color coded collated on a color-coded dashboard so that staff can immediately recognize who's red, who's yellow, and who's green. And so instead of waiting for these patients to show up for a quarterly visit or a biannual visit, we're literally risk stratifying our high-risk patients on a daily basis, sometimes twice a day. And that draws the doctors in, right? Because they want to know where they need to provide care. And when you reduce the complexity of caring for complex patients, that draws the nurses in, right? Because you're streamlining things on the back end if they can get to the patient earlier on the back end. And then finally, if you're managing that program, the last thing an administrator wants is another problem in her day or his day. So when you make those systems easy to manage, you've got to stay focused on those problems. You've got to make things easy. So patient engagement, I think clinical engagement from nurses and doctors, and I think reducing administrative overhead that's required to do things like this. And they all have to work together. And thank goodness, Medicare has I believe it's now 8 programs that pay for this type of activity.
Awesome. Yeah, and I'll give you an anecdote or story. When I was actually speaking with Our Care, they gave a phenomenal example. I think it was in the first month of using your platform, ironically, that they received a red alert. And sometimes, nurses, they get a lot going on. We have red flag fatigue, because of the EHR world and all kinds of stuff. They did not ignore that red alert, and they called the patient. The patient actually had a low blood pressure, and the patient normally has a normal to high blood pressure. So this red alert came in. They reached out to the patient and realized quickly that the patient was overdosing themselves mistakenly on pain meds, because what was happening is they were supposed to take it 3 times a day. They were taking 3 pills 3 times a day. And so they're actually going into an overdose situation, and they were actually, and the patient happened to have Narcan. So they said, can you please administer Narcan up your nose? And they did, and they saved the patient's life. So, that was a real life example of how your CCM platform, saved somebody's life. And that's when I kind of, all the bells in my head went off and go, this is what we're doing across the country with this type of program. And I'm so proud to be a part of the process of helping create these programs, back, the testifying back in 07, 8, 9, 10, 11, 12, 13, all those years of what created these programs, because we knew the vision. That's what you talk about, how Medicare is pumping so much money. It's because it works. It's because this preventive maintenance and this chronic care management does work. It's going to save this country trillions of dollars down the road. We're just trying to, right now it saves billions of dollars probably, but it's going to save trillions and trillions over the next 10 to 15, 20 years. We need that. Not only you're saving a higher quality of creating a higher quality of life, you're saving lives, offering much better care, but also we're going to save trillions of dollars out of our healthcare system. So it's a win-win for everybody. I love it.
Yeah, we get those like around coronary artery disease. We get those stories frequently from patients whose stents are no longer patent and they're failing, and they went from short of breath to really short of breath, and they're able to get back to those patients quickly before they have another heart attack. But when you hear them, you'll get tears in your eyes. Yeah. I remember this sweet little lady. I was in a boardroom at a cardiology system here in the Southeast, and she came over and she asked me, "Are you the man that invented this system?" And I thought, oh my gosh. Yeah. And then she told me about how she was, her husband was COPD and had advanced heart failure, and how just having this reminder to check in and update the doctor made her feel less lonely, made her feel more embraced. And then she looked at me and said, "Well, I bet your mom's real proud of you."
Oh, that's cool.
Yeah. So I'm standing in a room full of ladies and I'm getting ready to just start bawling. And I thought, yeah. So good. Yeah, you're right. There's a lot of goodness goes around.
Amen. For those that have tuned in a little late today, my special guest is longtime friend, Matt Ethington, co-founder and CEO of ChronicCareIQ. So how do you think your experience as a patient differentiates your product?
Because I think if you're going to manage anything, it can't be one-sided, right? I can't manage something I don't have information about, and I can't wait for people to provide me information. That's the healthcare system we have. We wait for patients to show up, and where do they show up? They show up in the doctor's office after they have significant disease progression, they've gotten worse. They show up in the emergency room where they're not going to be let go, or they show up in the morgue. So
Right.
my experience as a patient was, you know, I got home and I'm sitting here thinking, what happens next? I was scared of shots, and now I have to give myself 4 shots a day. I have to poke holes in my blood, in my fingers every day. I have to do it before I drive. I have to do it before I go to sleep. And what happens if? And it's a really difficult place to be, and there's a lot of anxiety, and that was 20 years ago, but especially today, we've only layered more barriers between doctors and patients. So if I needed to get a hold of my doctor, I'd have to call, go through the auto attendant, leave a message, wait for somebody to call me back, and that might be a while. So this was just having that way for patients to communicate the right information. It made me feel more connected, and it made me realize, like, everybody is surprised when they hear that 87% of patients that engage in chronic care IQ are still engaged a year later, right? That shocked to everybody. It never shocked me. Yep. Because it's a lonely place, right? People don't want to go through that alone, and the people that can help them are the doctors and the nurses. So I knew that patients would engage if you made it easy for them, and that's where we started, right? I remember Eric and I sitting in the library at my house, which is a fancy way of saying, the living room.
Yeah.
And saying, hey, this is what it needs to look like. And we called my primary care doctor and said, what would you need to know about a patient with stage 4 heart failure on a regular basis? And he'd say, I want to know this, this, and this. And that was really the genesis of the platform, is how do I get patients to participate? How do I make the information meaningful and easy to absorb for the clinicians? And then how do we make it easy to document and collect the reimbursements? And
excellent.
Yeah.
Excellent. So moving into the lightning round, we have about 4 or 5 minutes left. I want to get through a couple more questions. What could we look forward to in 2024 and 2025 in regards to CCM, RPM, and a dozen other codes that are reimbursed by Medicare in this area?
Yeah, there's over 20 monthly reimbursements, and they all deal with engaging chronic and fragile patients on a regular basis. So the manifestation of value-based care, right, is how do we get more preventative? We take it a little bit farther. How do we get more preemptive, keep those patients from disease progressing or going to the hospital? I think that you will keep seeing Medicare double down on these reimbursements and on these innovations, because they know they work, right? They're seeing the numbers on the back end. If you can delay or prevent a hospitalization, it's $100 a month compared to $25,000 each time.
Excellent. Fantastic. Love it. So I guess how has the care management market evolved over the past 10 years?
It's just gotten more robust. It's grown horizontally and vertically. Vertically in terms of what they pay for it. When we started, you could bill one increment of 20 minutes for $42. Mm-hmm. You can bill 6 of them now. Wow. And the first reimbursement is $64. That's a combination of the different programs. And then horizontally, it used to be primary care. Now it's primary care, specialty care, chronic pain management, respiratory care, physical therapy, behavioral health. It's really, getting into that value. It's wellness versus sick care.
Yeah. And like you're just mentioning, it just works too. I mean, when you look at, I've done a lot of research over the past 6 months in this area, looking also what's going to be coming out for the new codes in 2024, and the evolution, I should say, of the codes in 2024. But I mean, when you look at the patient satisfaction, the nurse satisfaction, the collaboration of care, that's just in care quality increases in general, saving lives, but also you got to bring in the financial aspect, because these physicians, these practices, these hospitals, health systems are getting so financially strained. And so to have this increased reimbursement, I mean, I think the average, that I was doing some research on your company and others, these physicians, these practices, providers, care teams should see anywhere from, on the low side, 5%, but more like 10, 15, 20% increase in Medicare reimbursement if you do this right and you have a good platform that integrates into your care strategy. So these platforms will evolve your care strategy. So you are participating in value-based care. You're participating where the future of healthcare is going. It's here and now. And so that's why I get really passionate. And I really wanted to have you on the show because I love the space, but also what this brings to our communities, what it brings to our patients, what it brings to our country in the way of higher quality care, and hopefully to stabilize the growth rate of our healthcare expenses. We're never going to spend less in healthcare, but we can at least slow down the growth rate as how fast our expenses are rising. That's what we're trying to affect at this point. Would you agree?
I would. We have 3 years retrospective data from an Ascension hospital that showed a 29, I think 0.4% reduction in all-cause hospitalization for these patients.
Wow.
So I think, honestly, I do believe we'll reduce healthcare expenditures. When you wait for bad problems to get worse, it's a catastrophe. When you engage early on, when the patient, when things start moving in the wrong direction, you can prevent a lot of problems, like fixing a water leak in your house. I don't have to replace the foundation if I fix the pipe.
That's right. So what's a couple more questions? What's the next big strategic step for ChronicCareIQ?
Yeah, that's a great question. The first thing is to do more of the same, right? I remember it would be a good month if we close 3 new customers. We've done 3, maybe 4. I haven't checked my email yet today in the last 24 hours. So more of the same, right? It works for doctors, it works for patients, it works for nurses, it works for everything, it works for Medicare. But the second thing is, I think it's going to be at the IDN level. We're deployed today across 170 practices, and I don't even know how many locations or thousands of doctors, in 14 different specialties. And if you look at a larger IDN, they don't have 4,000 doctors, in one skyscraper, all on the same assembly line. They are, 4,000 doctors in 180 practices, in 14 different specialties. And because we have an enterprise platform that can aggregate all of that, attribute the time correctly, attribute the reimbursements to where they need to go, and be a centralized place to get patient management metrics, get those that daily risk stratification, it's a real opportunity. And strategically, the direction of the company, what I'm going to be heavily invested in next year is finding those partners that say, yep, let's do this. Let's roll it across all of our fragile, complex patients.
Yeah, it's a no-brainer for organizations because, again, like I said right before this last question, this is an entree for everybody to participate in value-based care. This is a great step. It's a definition of value-based care. So it's like, you don't have to have this big complex model. You can just start with CCM and some RPM, and you've got a great strategy. You've got a great evolving care strategy. It's going to provide better patient care. It's going to be much more efficient for your organization, for your practice, for your clinic, for your health system, for your hospital. So it's, very exciting. I think everybody needs to look at it and see how it can affect your care, and if it's applicable. We probably got like a minute more. I would like to turn on the personal side. We'll have you back. And because I actually want to tap into the whole CEO side of your brain and your entrepreneur side. But we'll have you back for that. This has been a great show focused on care and CCM and RPM and those types of care models. So I'll ask you some other questions later on. You're absolutely going to come back as a guest. But on outside of work, where do you invest your time, talent, and treasure?
I have a family, 3 kids in high school, and a lot of my time is honestly it's at work. And in building this company, we didn't do it. We didn't go get a bunch of somebody else's money. We built it based on real experiences. And my co-founder and I basically paid ourselves last. So there's not a huge amount of treasure. We're seeing that the business is growing so quickly now that's changing. But I'm a pretty strong faith guy. So our family is involved in things like that, and just trying to take snapshots of the minutes as they go by so quickly.
That's awesome.
So spend a lot of time with family.
Fantastic. One last question, 30 seconds. Where do you go to get or be inspired?
I go to others, right? I have two groups that other entrepreneurs, just other people. One of them is a faith group. We meet early in the mornings on Thursday and Friday every week through Zoom. Your podcast, right? Some of there's a guy named John Halamka that I just absolutely love the way that he thinks, and it just stay open. Right. You can learn so much from so many areas. AR Care's staff is amazing. Right. And we go to them regularly, like, hey, what can we do better? So just being humble and being open and listening deeply, I think is always inspirational for me.
Matt, that was a fantastic close. Phenomenal show. Thank you so much. Keep up the great work. Very proud of what you've been able to build, you and Eric and the whole team there at ChronicCareIQ. Keep it up. And I'm sure I'll see you soon, my friend.
Thank you. Thanks, Justin.
And thank you so much to everybody for joining us today and taking time out of your busy schedule. If you miss any of this show or want to tune in, you can tune in weekdays at 2:30 p.m. Eastern and 11:30 a.m. Pacific. As always, you can track me on Twitter at HIT Advisor and use the hashtag #ThisJustinRadio so we can respond to your comments from the show. If you miss any of this episode or want to hear more, all my shows are posted at Apple iTunes, SoundCloud, iHeartRadio, and TuneIn. And we're going to be launching some new content on justinbarnes.com. So check that out too. Thanks, everyone, and stay safe.